So yesterday we saw in the news all over major national headlines and also major national media stations in Nigeria talk about the strike from Nigerian nurses. It commenced yesterday, and we are made to understand that it's a 7-day warning strike. And afterwards, if the federal government doesn't adhere, or if they do not come to an agreement, it might even worsen to an indefinite action. This morning, we're going to look at how this would affect, or how it's already affecting the health sector. What are the implications of this? The fact that we're also going to be experiencing some way or the other limited access to medical health care, and others would be our major attention this morning. And I have my guest to join in virtually this morning, right here in Edo State. I have Dr. Oluwa Joshua. Thank you so much for joining this morning. But just before I come to you, Dr. Joshua, let me quickly move over to an insight we actually gathered. Our news correspondent, Favor Osaro, gathered as regards the situation of things right here in Edo State. Take a look.
The nationwide strike, which began Wednesday, was declared by the national headquarters of the National Association of Nigerian Nurses and Midwives. The nurses are demanding improved welfare, fair allowances, and better working conditions across the country. A visit to key medical facilities, including the University of Benin Teaching Hospital and the Federal Neuropsychiatric Hospital, reviewed minimal nursing activity. Most wards appeared empty, with only a few nurses seen in informal attire. Efforts to reach the association officials in Benin were unsuccessful, as their secretariat remained closed during the visit. The 7-day warning strike by the National Association of Nigerian Nurses and Midwives is expected to end on August 5th. From the University of Benin Teaching Hospital here in Benin, Favor Osaro, ITV News.
No, thank you so much, Favor Osaro. Now let's move over to my guest, Dr. Oluwa Joshua. He is the Assistant Secretary General, Association of Resident Doctors, right here in Edo State. Thank you so much for joining this morning.
Yeah, good morning. Thanks for having me on the show.
Now, make it make sense what really is going on with the Nigerian midwife and nurses as regards the strike.
Well, we all know that the health sector has been experiencing a lot of issues in Nigeria for decades now, and particularly the nurses who form a very large bulk of the healthcare workers. They have certain demands which the government have left unattended to for many years now, and the conversation is they are going on strike, especially as the government has refused to attend to these demands. And it's a 7-day warning strike, after which they'll commence an indefinite strike if all of these demands are not attended to. So that's the issue ranging from salaries to workforce, issues ranging up to having the nurses in policy making in the country, as well as having a nursing department in the Ministry of Health. So these are the major issues that the nurses want the government to address, and unless they address, then the strike continues.
Okay, so at this point, what do you think would be the expectations right now from the nurses and the midwives? And what would they take to end the strike?
Well, I think it's pretty straightforward. Government calls them for a conversation, because as of now, I'm not aware if the government has called for any dialogue with the nurses union. So government calls them, or government should call them for a dialogue, then try to attend to the demands. If this is attended to, or if an agreement can be reached between both parties, the government and the nurses, then I think we'll see nurses go back to work. But if this is left unattended to, I'm afraid the service of the nurses will still be missing in our hospitals. So it's government having to call them for a dialogue and let them outline the issues over again. It's not like the government is not aware. Then they try to reach an agreement so that they can return to work to attend to patients.
So, on the front page of a couple of national dailies this morning, we saw that the news was, clear. Nigerian nurses begin their nationwide strike. And we're also beginning to see the implication it's having regarding the health sector, on the health sector in the country. But away from what the newspaper have, in your own view, what are some of those impact the strike would have on the healthcare system here in Nigeria? How bad
Yeah,
would it be?
it's going to affect a lot because nurses make up to 60%, about 50 to 60% thereabout of the health workforce. So seeing that these people are not on ground to attend to patients, then there are going to be serious issues. For example, for many hospitals now, patients are a lot of patients who were being attended to are no longer being attended to. So they are going to have to seek care in other places. And we already have shortage of nurses, first of all. Then even healthcare facilities, we already have a shortage of that. So if patients are not getting care in government hospitals, then they tend to go to private hospitals. Now, how many of us as Nigerians can afford care in private hospitals? Then, even when they go to the private hospitals, how many people can they really attend to? Because the government hospital, of course, they are the largest, they're the biggest in the country. So, a lot of persons are going to miss out on care. Many people have had to leave the hospital because there were no nurses to attend to them. So, I don't know how bad it's going to get, and we don't pray for it to get so bad, but at the moment, I think it's really terrible. People are not getting attention to care. We may be seeing um, bad numbers later, people not getting admitted into the hospital because there are no nurses to care for them, or those who were previously on admission have had to leave to look for care elsewhere. And I don't know where exactly they're going because nurses are still on strike. So it's going to be bad, even though we don't pray for it to be bad. That's why
Right.
I'll also join my voice to call on the government to attend to the needs of the
Absolutely.
nurses.
Absolutely. That's why we are talking about it this morning. But you did say something regarding having nurses leaving Nigeria. The question is why? What is the package? What is the welfare package of nurses in Nigeria? What's the salary structure? Is it enough to take home? Or is that why we are seeing them living in drones? It seems the situation regarding the brain drain is also affecting the medical sector, and the nurses are not left out at this point.
Yeah, that's a major issue affecting all health workers generally. For the for health workers, the salary structure is the CONMES and the CONHES salary structure, and the nurses are pushing for a review or a change in salary structure. In fact, there was a review of the salary structure that came out, I think, earlier this month, and the outcome of it was very unpleasant to health workers generally. And one of the demands that the nurses are asking for is for that particular salary structure to be retrieved or to be reviewed, and another one implemented or given to them, because the what the salaries are, they are not commensurate to the amount of work that health workers do, that the nurses do. So one of the things they are pushing for is that let the salary that you're paying us be equivalent to the amount of work that we are doing. And that's why we see many nurses leaving the country for other nations, because they know how much their colleagues in other countries earn. They look at their colleagues in other countries, having worked for a few years, there's so much that they can
The
themselves and their families. But here in Nigeria, the case is different, whereby your take home cannot take you home, as many of them would say. So the struggle is that salaries do not reflect the amount of work that the nurses put in, and they are requesting a change, review, or you know, yes, a change in the current salary structure for the nurses, as well as other allowances that they are fighting for.
Now, so far so
Yeah.
good. How would you rate the government response to this? Because if I'm not mistaken, before this one-inch strike began, we heard that there were some talks regarding talks between the federal government and also the association, and it seems that it ended in a deadlock, or there was no forthcoming from the federal government, and then we're now seeing this warning strike. How would you rate government response so far?
Well, from the part of the government, I know there was a 15-day uh, ultimatum that was issued to the government, and there was a meeting, and the meeting was inconclusive. It ended in a deadlock for which the nurses proceeded on the strike. I'm not quite sure how the government is responding to this, but I feel that if it was significant enough, this strike would not happen. All right. Yeah, I feel if it was significant enough, the strike would not happen. And even at the moment, I'm still not aware if the government has issued or called for any talks concerning the current strike action. So, uh, for the response of the government, probably they have responded or probably they made some offers, but we are not seeing the effects of it, because if really was effective or the response was significant enough, I'm sure the strike wouldn't have happened in the first place or should have been called off by now. So I'm also urging the government to look into the situation again.
Yeah, so I vividly remember a couple of days ago when we lost the former president Muhammadu Buhari, and there were talks and eulogizing his stay, and a lot of Nigerians actually questioned why he actually passed away in London, and why we also get to see medical tourism happen over time. And I remember a particular spokesperson came out responding and saying that if the former president had been in one of the hospitals here in Nigeria, he would have been long gone. So, is it a situation of the government not knowing what to do, or it's a situation of them not wanting to put the right measures, the right technical equipment in place for us to have a world standard hospital, a world standard, welfare package for the nurses, so we don't have to see politicians and persons who are able to, to sponsor themselves abroad to get to do that every single time. Because at the end of the day, the reality is an average Nigerian, how many persons can afford traveling overseas to get the required treatment, to take care of themselves? So what do you think is playing out? Is it negligence from the part of the government, or it's just a Nigerian thing? And should it even be that way?
Well, there's nothing as good as having your own. And this is something that I think the government needs to realize, that it's always best to have your own property or your own whatever. It really makes life easier. So I think, or I believe, and I urge that the government would go in and put the right infrastructure in place, the right welfare packages in place, and employ health workers, as many as possible, pay them what they are worth, put facilities, equipment in place, because one of the things that we are fighting for generally as health workers, doctors, nurses, pharmacists, lab scientists, everyone in the health sector, is that you put things in place, equipment, tools in place to enable us to carry out our work as effectively as possible. So when you visit a hospital in Nigeria, the conversation should not be that, oh, this item is unavailable, so we can't attend to you. And because those in power know that this is the current situation of what is happening in our health centers, and they have the funds to go outside to seek care, then they can easily just do that. But if we have the right equipment in place, we have the right um, number of workforce in place, because we're even losing most of our very good brains. We have people who are very sound, highly intellectual, but they have left this country to other countries to practice just because the government is not attending to their needs. So if we have all of these people in the country, we have the right equipment, even the government officials would even patronize their own healthcare system that they have put in place. So this is something that I call upon the government to address, both for, yes, for all Nigerians, including they themselves as government officials. Thank you.
So, just before I let you go, what would your message be to the public and also patients, Nigerians in particular, who are majorly affected by this strike, or by this warning strike?
All right, thank you very much for.
Dr. Joshua, you there? Okay, so it seems we're having a bit of network glitch at this point. That's also one of the major things at some point we will talk about here in Nigeria, how we can move away from all of the network glitch and have a free, smooth, wonderful connectivity moving forward. But I would really love to get Dr. Joshua's message to Nigerian and what you would be putting in mind at this point. Would this warden strike be on and just end on August 5th? Are we going to see the federal government coming on board to ensure that their demands are being met? I mean, what are some of those demands, if you ask me? What are some of those demands? Having a good welfare system, an improved welfare system, increased professional allowances. Okay, so it's good that we have Dr. Joshua back. So just before we leave the conversation here, what would your message be to the public,
So the
Nigerians in
Nigerians.
particular,
Yeah.
and also patients who are affected by this warden strike?
All right, so I would use this opportunity to call on all Nigerians and first of all mention that the health workers are not the problem of Nigerians. If you have visited the hospital before, you would see that there are so many of us who give our best to this work, ensuring that our patients get the best care as much as possible. But when the right packages are not there for us to effectively carry out our duties, then we won't be able to tend to you effectively. That's why you come to the hospital and there is a long queue because there is not enough people, there are not enough nurses to attend to patients. So I call upon the general public or Nigerians to also add voice to the voices of the nurses and health workers in general to demand for better welfare packages for the nurses, improve salary structure, uh, 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 increased number of healthcare workers in our hospitals. So I urge the public to join voices to the nurses and also call upon the government. This is not the time to start saying that health workers are wicked, health workers are evil. They are not. They were trained to give care. All right. So when we call upon our government and they have attended to the needs of these nurses, then I'm sure that every one of us will be happy eventually. Yeah.
All right, thank you so much, Dr. Ore Olua Joshua, Assistant Secretary General, Association of Resident Doctors, Edo State Chapter. Thank you so much for your time this morning.
Thank you.
That's how we'll leave the conversation here. It's an ongoing one. So let's hope that the federal government will come in speedily and do the right thing so that this warning strike will be called off and we do not have persons being affected drastically. Now, we'll quickly take a short break, but when we return, we'll move over to another major issue. Now, this time around, the lawmakers are moving to bar civil servants from using private schools and hospitals. Would this bill see the light of the day is the big question. We'll find out right after this break.